My name is Nicole Waner. I'm a doctor of physical therapy. Today we'll be talking about therapeutic technologies for wound healing. We have no disclosures. Today's objectives will be to discuss 3 therapeutic technologies for wound healing, describe the cellular interactions used for these technologies, and describe each contraindication for the technologies described. Therapeutic technologies are used in addition to appropriate wound care. Before utilization of technologies, the care team must ensure that all standard of care practices are already being performed and local and systemic factors are being addressed. Adjunctive therapies are added to a wound condition based on its normal process of healing. Adjunctive therapies are only added if the wound is stalled or not healing to its normal course. Listed are the 4 categories of therapeutic technologies. Thermo will include types of ultrasound as well as hot packs. Non-thermal types of therapeutic technologies would also be types of ultrasound as well as certain type of lasers. Mechanical would include whirlpool as well as ESTIM or electrical stimulation. Electromagnetic is infrared light and ESTIM. All wounds, regardless of underlying pathology, can have non-viable tissue, can become chronic or stalled at any stage of healing, can become infected, or they can have difficulties with circulation, edema, hydration, or nutrition status, or can be painful. Indications or when to use therapeutic technologies can include any of the following list, and these can happen with any types of wounds. It can assist with wound cleaning or debridement, the treatment of infection or biofilms. It can help stimulate cellular metabolism, improve circulation, or simply assist with pain control. The 3 types of therapeutic technologies we'll be discussing today is ESTIM, Pulsatile Lavage with suction, and non-contact low-frequency ultrasound. There are more types of therapeutic technologies used for wound care, but these are the 3 most researched and most used in clinical practice today. The first therapeutic technology we'll be discussing is ESTIM, or electrical stimulation. The following are the 4 main principles for ESTIM: polarity, or positive or negatively charged poles, the voltage and current. So the voltage is the driving force, and the current is the direction of movement of those forces. Waveforms, which can be composed of many different manners that will depend on your goals for the wound care, and pulse charge. The following are the types of currents used that can be used for wound care. High voltage pulse current is the one most used in human studies. The following are 3 main theories or effects of ESTIM on wound beds. The current of injury theory states that there is a normal negative charge on an undamaged skin surface. Once the skin gets damaged, it affects the normal negative charge on the skin, and ESTIM is thought to help replace that negative charge. Galvanotaxis is the second theory. This theory states that each type of cell has an either positive or negative charge. Depending on the goals for wound care, you want to attract certain type of cells to the wound bed. So for example, if you wanted to attract fibroblasts and they're negatively charged, you would place the positively charged pole inside the wound bed during treatment. The third theory, and least researched, is reducing edema and helping increase blood flow. This theory states that ESTIM helps restore the natural blood flow to the wound bed in order to assist the healing process. This table demonstrates examples of positively and negatively charged cells in order to help direct your wound therapy. As I mentioned, if you wanted to assist in epithelialization of your wound, since it is a negatively charged cell, you would want to place the ion or the anoid catheter into the wound bed. The other effects of ESTIM on wound beds include stimulating cells, including fibroblasts to assist the healing process, ESTIM also assists in remodeling and scar formation. As we mentioned, ESTIM has a role with increasing blood flow, including increasing vasodilation to the wound bed. ESTIM can also assist in decreasing the bacterial burden on a wound bed. As well as assisting with biofilms, ESTIM can also facilitate debridement. Contraindications for ESTIM include if a wound is simple or uncomplicated. Malignancy and osteomyelitis are also contraindicated for use of ESTIM. You also want to consider what type of topicals you are using for dressings. If any type of topical containing metal ions are used, you want to ensure frequent and thorough cleansing of the wound bed prior to initiation of treatment. Metal ions can cause hotbeds or may cause burns in the wound bed. ESTIM should also be avoided over any reflex center or any pacemaker. Pregnant females are also contraindicated for the use of ESTIM. Listed are the codes used for billing ESTIM. As an important note, please ensure that there has already been 30 days of conventional care to the wound prior to the initiation of ESTIM. If 30 days of conventional care are not completed, ESTIM will not be covered by insurance. And now we'll demonstrate the application of ESTIM on a wound bed. Here we have our setup for ESTIM for wound care. We have our machine, gauze, saline, leads, and our electrodes. So we'll plug in our lead next in the high voltage output. Next, we need to prep our wound bed. Before starting ESTIM, you want to make sure you clean surrounding skin as well as thoroughly clean the wound bed. You'd also want to perform any debridement that is appropriate. In this setup, we'll be using 2 electrodes, and I'll first demonstrate the placement of the electrode within the wound bed and one outside. We would use our gauze and moisten with saline. Place the saline moistened gauze within the wound bed. It does not need to be packed firmly, but enough to cover the wound bed completely. Next, you're going to place the appropriate electrode on the wound bed. Depending on what type of goals you have for this therapy, you'd choose the negative or positive lead. In this machine, the positive lead is marked red and the negative one is marked black. So in this case, we will want to demonstrate a negative lead to promote epithelial healing. So we'll place the negative electrode right on the saline moistened gauze. If you'd have a real patient, you would want to ensure this gauze in the wound bed is not able to be moved during the treatment. You would next place your other electrode proximal to the wound bed. So if this was your abdomen, you'd want to place it above the actual wound of the abdomen. Since our model is not that big, we'll place it here to demonstrate. Next, you would want to turn on the model. Make sure you choose high volt and set the time. You would gradually increase the intensity until the patient states they're feeling a buzzing sensation, but not enough to create a muscle contraction. Inclusion criteria for ESTIM include multiple types of wounds, burns, pressure injuries, venous insufficiency, as well as surgical type wounds such as donor sites and skin flaps are all appropriate for ESTIM. Precautions for ESTIM could include patient history of irritant under the electrodes, any patient with reported increased pain with ESTIM, patient with decreased sensation because they will not be able to state whether the therapy is causing increased pain or not, children under the age of 3, and people with cognitive impairment. This slide is a review of the exclusion criteria or contraindications. So presented here is the first type of treatment technique where we have an electrode within the wound bed. The second type of treatment technique has to do with bracketing the wound, and I'll demonstrate that next. Just like in previous technique, you would still want to make sure your wound bed is clean of any debris and complete any debridement prior to the initiation of therapy. So when we bracket a wound bed, we just want to line the outside of the wound with the electrodes. This would be to promote any overall effects of ESTIM and not targeting any specific cell. Application for ESTIM typically begins with the negative pull within the wound bed, but can vary after that depending on the demonstration of your wound. Frequencies can vary anywhere between 30 to 120 pulses per second. Treatment duration needs to be anywhere from 45 to 60 minutes and 5 to 7 days a week. Electrode placement should be 15 to 30 centimeters apart, typically for bracketing, but you want to make sure you go outside of your wound. It's important to document the placement of the electrodes. So for this example, I'd want to note that the negative pull is on the distal end of the wound and the positive end is on the proximal end. During my next treatment session, I would note to rotate the electrodes in order to vary the direction of the electrical field. Again, here's the list of possible therapeutic currents for wound care. We use high voltage pulse current most frequently. Here are a list of the parameters for the other types of current, depending on what type of ESTIM machine you have. Sometimes high voltage current is not a possibility, and these are the appropriate parameters for wound care. Outcomes for ESTIM should include a decrease of the wound size from 80 to 100% within 4 to 6 weeks. If you do not see this decrease in size, you should consider stopping ESTIM, maybe for another modality, or change other parts of the wound care plan of care. And now we'll move on to pulsatile lavage with suction.
Hi, I'm Randi Privette, Doctor of Physical Therapy. I am currently the Wound Care Clinical Lead in the PM&R department here at Mayo Clinic, and I'll be talking about pulsatile lavage with suction. Some of the foundations of using this technology are the hydropressure cleansing at the same time as using concomitant suction. This actually started in the OR. You might be familiar with a water pick, which actually uses much higher pressure than what this does. This fluid pressure is typically between 4 to 15 psi, and the suction pressures used are about 60 to 100 millimeters of mercury. This is considered a non-immersion type of hydrotherapy, and typically the irrigant is saline. Some of the advantages of using pulsatile lavage with suction over traditional hydrotherapy is that you would know the exact pressure you are using on the wound. It also decreases the risk for potential infection and cross-contamination, as you would have with a whirlpool. There's also decreased edema formation, considering you don't have to put the limb into a dependent position. Also patient comfort, having to transfer them into a whirlpool or Hubbard tank. It also decreases resource utilization, as pulsatile lavage with suction is typically a one-use item and then can be disposed of later. It has been researched that there is increased granulation tissue formation as well as improved wound closure rates while using pulsatile lavage with suction compared to whirlpool. The effects of pulsatile lavage with suction include removing adherent non-viable tissue, crusts or debris, excess exudate, bacteria, and any extra topical agents. It also facilitates debridement, as well as promoting a moist wound healing environment. It also is able to stimulate fibroplasia and improve circulation. Instances where you might pick this technology are a variety of wound pathologies: pressure injuries, neuropathic wounds, venous or arterial, even post-surgical wounds. Deep wounds with undermining that other technologies may not be able to reach, wounds that have a high amount of eschar or non-viable tissue. You can also use pulsatile lavage with suction in preparation for sharp selective debridement. It is also beneficial in post-surgical wounds to maintain a clean wound bed. Suction is typically used to remove the irrigant while you're loosening debris. It does also have the same effect as negative pressure wound therapy by stimulating blood flow through angiogenesis, physically pulling on those blood vessels to improve the blood flow to the wound. The benefits of using pulsatile lavage are that you can be site-specific compared to using an immersion therapy. It can also be used if immersion therapy is contraindicated. It has a low risk of cross-contamination as long as you ensure to treat the cleanest wound to the dirtiest wound, and with complying with disposal practices for single-use components. Precautions when using this therapeutic technology include patients on anticoagulation therapy and areas that may be insensate because the patient can't tell you if they're feeling pain with that treatment. Wounds that might have exposed arteries, nerves, tendons, joint capsules, or bone, any wound on the face, and any recent graft or surgical site. Contraindications for this technology include patients that would have a latex allergy based on the equipment that's used, and any perineal or perianal fistula that would be adjacent to a body cavity. Things to keep in mind for environmental infection control are doing this treatment within a private room that have walls and doors. Avoid areas where patients are multiple in one room and curtained off. Use continuous suction, and the splash shield must stay in contact with the wound bed throughout the course of treatment. Empty the suction waste canister after each use, and each canister should be a single patient item. Ensure you dispose of all single-use components properly and thoroughly clean and disinfect the environment. What you should expect when performing this modality is that the wound should demonstrate decrease in non-viable tissue and inflammation within 2 weeks. A study found that there was a decrease in non-viable tissue by 37% in 7 days and 66% in 14 days. You should also notice a decrease in odor and exudate. The wound should also progress from the chronic inflammatory phase to the acute inflammatory phase within 1 week. Consider discontinuing treatment if the wound has closed, if there's no increase or advancement of the granulation tissue within 1 week, and no decrease in necrotic tissue in 1 week. Also discontinue treatment if the patient cannot tolerate due to pain. On the screen, you'll see the code for pulsatile lavage with suction, which is considered mechanical debridement. And now we'll see a demonstration of pulsatile lavage with suction. When setting up pulsatile lavage with suction, you will have a handpiece, a splash shield sheet, and the cone tip, which is meant to stay in contact with the wound bed for the duration of treatment. You'll have suction and a suction canister, and your irrigant, which is typically saline. This particular device has a 3-speed setting, which allows me to choose 4, 9, or 15 psi for my treatment session. I would recommend using lower pressures when needed, particularly if pain is encountered, if you're within a body cavity, or if you need to use the straw tip applicator for tunnels. Suction pressure when using 4 to 9 psi is typically 100 millimeters of mercury. You may need to use higher suction when you use higher pressures, and lower suction when using lower pressures if pain is encountered or when using the straw tip. Session duration will be dependent on the size of the wound and the amount of irrigant that you're using. When setting up your treatment plan, typically you would do pulsatile lavage with suction daily if the wound has greater than 50% of necrotic or non-viable tissue and has purulent drainage. You would reduce frequency to 2 to 3 times a week once you have achieved full granulation within the wound bed. And now we'll hear from Marlene about non-contact low-frequency ultrasound.
Good afternoon. My name is Marlene Einertson. I'm a doctor of physical therapy and a certified wound specialist here at Mayo Clinic. Today I'm going to be talking about non-contact low-frequency ultrasound mist. The foundation of non-contact low-frequency ultrasound mist. Two foundations, cavitation and acoustic microstreaming. Cavitation involves the vibrational effect on micro-sized bubbles. Changes in bubble pressure from the waves of sound cause expansion in the contraction. Stable cavitation enhances acoustic microstreaming, and unstable cavitation can disrupt fibrin, slough, and biofilms. Acoustic microstreaming is a high-velocity fluid gradient along cell walls, bubble, and tissue boundaries. It increases cell membrane permeability and upregulates cell membrane and organelles, including protein synthesis, degranulation of mast cells, and increased release of growth factors. Non-contact low-frequency ultrasound is again low frequency, about 40 kilohertz. It's delivered through droplets of saline, and it promotes the healing through cellular stimulation, which are acoustic streaming and cavitation. It's painless and non-thermal, and it has no measurable PSI pressure. The penetration of the ultrasound waves is about 5 to 7 millimeters below the surface of the wound. What we can expect from low-frequency ultrasound is bioburden control. The sinusoidal waves fracture bacterial cell walls, and it enhances the use of antibiotics and antiseptics. Low-frequency ultrasound increases blood flow by increasing angiogenesis and vasodilation. It facilitates debridement by breaking the bacterial cell walls, and it decreases pain in the wound bed. Contraindications include not using it near electronic implants or devices, over the pregnant uterus or over untreated cancers, whether that be solid tumor or systemic cancers. On the slide, you see the coding for non-contact low-frequency ultrasound. It is a procedural code and it is not time-based. Consider discontinuing ultrasound if the patient is unable to tolerate the therapy or there is no evidence of progress in the wound healing, which includes no decrease in the wound size, no decrease in the wound exudate, no decrease in the amount of necrotic tissue, or no advancement to the next phase of wound healing. We also would not use ultrasound mist over a previously closed wound. Now we will demonstrate non-contact low-frequency ultrasound mist. You can refer to your slide for the inclusionary criteria. Pretty much it's just about any wound that is mostly clean. Exclusionary criteria are the same as the contraindications, which include electronic implanted devices, lower back during pregnancy, a pregnant uterus, or over areas of malignancy. This specific machine calculates treatment time on wound size. So you don't really need to bring your calculator. You don't need to do any calculations. I can choose what time I'm going to treat depending on what size the wound is. So I'm going to choose the smallest one for the demonstration. It tells me exactly how much saline I'm going to need for the treatment, and it tells me that I need to close the door so the saline will pump. It's important that you hold the mist close enough to the wound bed so that you hear a sizzling sound. That indicates that you're getting the acoustic streaming and the cavitation. Treatment should go in a plaid pattern, so back and forth across the whole wound surface, slowly, and then side to side. You can pause treatment at any time if you need to soak up any extra saline or reposition the patient for any reason. Our protocol here at Mayo Clinic is for 3 to 5 days in a row initially. We would never do it twice a day because that is not reimbursed and the research does not show that that's helpful. Our goals are to decrease non-viable tissue, decrease infection, decrease pain, decrease size. After the initial 3 to 5 days of daily treatment, we would then switch to 2 to 3 times per week, which is a standard of care frequency. Daily patients convert to 2 to 3 times per week on day 5 of treatment, and after 6 sessions of the 3 times per week, we would reassess to see if treatment is still appropriate. The total number of sessions is based on the wound response. Our appropriate responses would be an absence of odor, a decrease in drainage, a decrease in necrotic tissue, and an increase in granulation and epithelial tissue. Once we have achieved wound closure or epithelialization and wound health, we can discontinue the mist and switch over to dressing changes only. You can refer to the further slides for expected outcomes in 2 weeks and 4 to 6 weeks, and after that. Thank you for joining us on our education of therapeutic technologies for wound healing. I hope this was helpful.